Hello, LinkedIn, and welcome to our familiar LinkedIn Lives after our summits. It's my great pleasure today to have with us Bijay Singh, who is joining us from DKSH. As many of you know, he gave an insightful presentation during the COVID-19 Vaccine Summit on the 4th of February, and here he is today to answer some of the questions that were asked then, as well as to take some more questions from you guys and girls on LinkedIn, as well as on the event platform. So shoot away, comment away. Brief intro before we jump into to Bijay. So he's the Vice President Global Business Head for the Business Unit Healthcare for DKSH. He has more than 25 years of experience in the healthcare industry. He's responsible for the strategy and operational execution of the DKSH Healthcare Business Unit globally. The healthcare business unit is the largest as well as the most profitable business unit of DKSH, which, as many of you know, is the leading market expansion services group with a focus on Asia. Bijay will be sharing with us today a lot more of his thoughts in terms of the challenges and opportunities in bringing the COVID-19 vaccine into Asia. It was a topic of his presentation, and yeah, delighted to have you, and thanks for joining us, Bijay.
Thanks, Radu. Looking forward to the questions.
Super. So I see already that people all over the world are tuning in, which is great. Maybe let's start. There was one good question that I wanted to start with, and I think it's on a lot of people's minds, which is in terms of the last mile. You also spoke about it in your presentation, but maybe let's take the opportunity to speak a little bit more at length, because when you're dealing with the geographies that DKSH is dealing with, Thailand and some of these countries that have very rough last mile requirements, obviously there's going to be some big challenges around that. So maybe tell us a little bit further to your presentation. How do you plan to do that? You also spoke about cold boxes on the back of motorcycles to get some flexibility. Share more.
Thanks a lot. So, Radu, across Asia, we work in 14 countries, and they range from small territories like Macau and Singapore, which you can, travel within an hour across the whole country, to huge countries like Indonesia, Philippines, Vietnam, Myanmar, where, like you said, the terrain is very varied. It's geographically very large. It's very challenging to get across the country. Sometimes the infrastructure is not excellent. And, frankly, in many of these countries, a lot of the population, maybe over 50%, is still rural. They do not live in cities. And, the population density that you see in a large city like a Manila, Jakarta, Bangkok is not the same when you go outside and you go to some of these rural areas. And how do you access? Because quite frankly, their proximity to medical centers is not great, right? They don't necessarily have, for many of these people, easy access to healthcare professionals. So I think, point number one, we have to understand which company can access such a large geography. And, DKSH serves over 150,000 customers. When we talk about customers, those are healthcare centers, hospitals, clinics, pharmacies, variety of customers, as we say. And in many of these countries, we essentially operate directly, okay? And so we can go all the way to the north of Vietnam, the north of Myanmar, various islands, and that allows us to get there not only directly, but with the right quality. So we have the right infrastructure, which could be, as you said, refrigerated trucks, small vans, motorcycles where you need to. So you've got to adapt the right transportation to that environment. And very importantly, Radu, because we work in a regulated environment, this transportation has to be quality checked, and it's got to be of a regulatory standard, not only to fit the country, but also to fit the client requirements and DKSH requirements. So essentially, we will always operate to the highest of those requirements. So if one of those is a bit lower, we will go to the highest. And that will mean the logging of the temperature in the cold chain package. So a lot of people often ask me, Bijay, why isn't delivery as simple as putting a pharmaceutical product into an Uber or a Grab? Why couldn't it be done as easily as that? And I often ask them, yes, well, you could technically do it, but our role as a healthcare distributor is to assure the quality of the product all the way through the transportation. If that Grab or Uber or car is stuck in traffic for hours, it breaks down. There's no air conditioning. It's in hot temperature. We cannot say whether that pharmaceutical product, or in this case, vaccine, is still going to be a quality standard that when injected into a human being is going to give the efficacy that's promised in the clinical trials.
On the point of, there was another question that was very good. I also, I encourage people to keep commenting your questions. We will get to them in a moment. There was another question that came through regarding data, and I know that you guys work very closely with governments, with Ministry of Health across the different geographies that you serve. Most of the doses of the vaccine, most of the vaccines, or some of the vaccines have 2 doses, right? Walk us and talk us through a little bit on how does the data integration layer, who took the jab, who took one jab, how when do you need to take the next jab, all of that infrastructure comes into play, and how do you guys play a role into that?
Sure. So, the first part of the question is, on the data stream, what types of data would be interesting? I mean, clearly, as you get into monitoring patients, as you say, contacting patients to schedule the appointment. Now you see in many countries around the world, they're not just coming into clinics, there just isn't the capacity. They're actually repurposing large sites. They could be even stadiums, sports stadiums that they're repurposing. How do you schedule the person to come to the right place at the right time? You don't want, elderly people waiting for hours outside a sports stadium. Even as they are, what do you do to make sure that as they're waiting, they're well looked after? So number one is just the scheduling, contacting them. So that ideally that system would also have a linkage to be able to contact them through phone, through email, through social media, whatever is the right mechanism, so that could just be an automated process. It's automated that they are contacted. Maybe it's even automated that they reply and they confirm. Think about when you make an appointment anywhere, your hospital, your hairdresser, or whatever. Typically somebody calls you the day before and says, just want to remind you, Mr. Singh, Mr. Radu, that you have an appointment, remember to show up. Maybe the system can automatically do that. And I think there are many systems that do that. Then, as you said, tracking the patient for the second dose. But beyond tracking them for the second dose, Raju, there's another very important thing, but again, this has to be very well regulated, which is something called pharmacovigilance. So once a product enters the body, we all want to know what the side effects are, right? I mean, remember months ago when we started to hear about the vaccines coming out, we were super excited that they were coming out early. But what was the question on everybody's mind beyond will they be effective? How do they know they're safe? These products have been in development for such a short time. They've only been, in studies in a limited group of people. So really, we'll only know about side effects through real world evidence, as they say. So I think this pharmacovigilance and reporting and actually reaching out and making sure patients can quickly report back, I had this side effect, I had some flu-like symptoms, or a rash, or something more serious, and even death. I mean, if a patient dies after a vaccine, sometimes they're not attributable to the vaccine, but it's important to know, and then later on you can do the studies. So all of these things are very, very important, not only on the micro scale, Radu, but imagine for the macro scale. Imagine as healthcare systems start to look and understand how patients respond to different vaccines. How do they respond to different delays in the second dose? How do different ages respond? Different ethnicities? What are things that we can learn about epidemiologically that will help the second country, the third country, which might be later in line in receiving the vaccines, turn around and say, I've learned now something from the first wave of countries, I'm going to do this differently. This type of vaccine actually works better in this type of patient or in this type of situation. So I think beyond the micro, there's also lots of macro to be learned from this. Finally, you asked, what role does DKSH play? Well, primarily we're a distributor and a commercial outsourcing and services provider. But something we've been doing in the last few years of late is entering an area called patient solutions. And what patient solutions is to address issues around why there are leakages in the patient journey. And often the leakages that we think we can address is related to awareness, access, affordability, and adherence. So the 4 A's: awareness, access, affordability, adherence. These are often reasons why patients drop off or don't take the right medicine. And through our DKSH cloud-based solution for patient solutions, which we operate through a partner company, we're actually able to monitor thousands of patients that are on product and help them make sure they take the product at the right time, their questions are answered. If they have affordability issues, sometimes the clients or the providers or the manufacturers want to encourage patients to continue therapy, and the way they do that is by giving some financial incentive to continue. They're not allowed to house that patient data themselves as manufacturers for patient confidentiality reasons. They come to providers like DKSH, and we have invested in great SOPs and great systems, and we've been audited by the largest multinational companies in terms of the rigor of these SOPs for patient confidentiality, for the systems, as I say, and they've all worked out. So we believe we could scale this patient solutions cloud-based platform for this kind of application very quickly, very easily, in the event governments would be interested to employ something like what I described in the first section. Thanks.
Oh, and I guess there's some positive data, very encouraging data coming out of Israel at the moment, which is the leading country in terms of the speed and velocity with which they're doing the vaccinations. And it's obviously helpful specifically for the points that you mentioned, because we are lacking the data on specific demographics, age groups, ethnicities, and so on. So hopefully that database will grow, a solution like yours and many other providers. And then we grow this kind of almost global knowledge database to help us push through. I'll pull this question for you. I think it's a relevant question from Apollosi. Not necessarily only in IT network or internet. I mean, let's talk basics. We have power shortages, right? In some markets, there's as basic as there's electric current doesn't work, right? So I guess. How do you ensure the backup plans or the contingency plans, or maybe talk us through a little bit, Bijay, in terms of how DKSH manages to push through all the different challenges of the different terrains in Southeast Asia and Asia in general?
Yeah, look, thanks, Radu, and Policy, thank you for your question. So let me start before your question regarding, how do we protect and ensure backups? And certainly, if something we know in Asia is if there's the Irish saying of Murphy's Law of if something can go wrong, it will. And we know that, for example, as you said, power outages are typically one thing that, happens a lot. Sometimes electricity transmission is not reliable. Sometimes you have blackouts or brownouts. So it's very, very important to have redundancy systems. And those redundancy systems could be backup generators, other types of redundancy, backup, even for things like warehousing, transportation, backup trucks. You always need to be thinking about what's the redundancy required. And of course, that redundancy costs you something, but on the other hand, what's the cost of a completely destroyed product because it's no longer, usable by human beings? So that's how we operate that. And to the question that was raised, I mean, clearly, I don't have a magic wand to answer that. It's a great question. We all know, I laugh often about these James Bond movies where, I'm just in the right scene, you've got the data network and it just transmits beautifully. And when I'm, up country in some place in Bangkok, in Thailand or something, my internet never works as well as in those James Bond movies, Radu. So the laugh that I have is, in that case, it might be humorous, but the real story is, how many times do we all look and say, oh, I don't have a good signal here, I need to move here, and then I need to move here, and you walk around. So that is a par for the course or just a matter of life, regular life for most of the people there. And you have many spaces which unfortunately don't have that connection. So it's a very good question. And you're going to have to rely in many of these countries on offline systems as well as online. You cannot rely that it's going to be 100% online like you could in a Singapore, like you could in a Macau, maybe a Taiwan. In a Myanmar, particularly in what's happening with Myanmar today, you cannot rely on that. So it's very, very important to have backup manual systems, particularly as you go into rural areas.
A topic that is on the minds of a lot of people, and we've had this discussion on some of the panels at the summit. Is a topic that keeps popping up, and again, there's no silver bullet, but there's something that needs to be looked into very carefully. Is the vaccine counterfeit problem? Is the fact that they've already, I think organized crime is quite closely looking into this as a money-making opportunity and doing all sorts of dodgy practices. And I guess that traceability, right, from the factory to the moment that it is delivered to the patient and injected into the patient's arm is quite key. So how are you addressing that, and what are some ways to ensure that that authenticity is there?
Yeah, Radu, I've worked in this industry for nearly 30 years, and I remember, over the years how counterfeit, spurious products, or beyond counterfeit, I mean, really products that are not just fake, but actually cause harm to patients, have been around and caused a lot of death. And it's just tragic that, in a time when people are looking for hope, you've got profiteers that are, have low moral standards and willing to resort to this to make a buck. I think the simple answer I can give you is, DKSH only works with reputable clients. We don't just source product from anywhere. So it has to be products from companies with strong brand names, strong reputations, regulatory approvals. And we know because we have, and we can attest to the product source because we're often the ones that are doing the importation for them or helping them. We're the ones that have helped them maybe with their regulatory approvals. Certainly we have all of those documents on file. So we know that these products are the real deal, so to speak, and that they've come from approved sources. But I do understand that, if you are a patient in maybe not even a rural area, it could be a city, and you don't have very much money, and you go into a store and somebody turns around and says, I've got a deal for you. Sometimes saving money when you don't have much, and it's easy for all of us to say because we have enough, is a big thing, because it means the difference between eating or not eating, paying the rent or not paying the rent, having electricity or not. And so saving a little bit of money, by having a vaccine that you don't know much about, or they call it a vaccine, a product, and they bought it from, let's say, a non-registered outlet, or unfortunately a registered outlet that has compromised principles and is willing to make a fast buck. So all I can say is it's really important when it comes to the vaccines to make sure that you get it from attested centers. I'm sure the governments will make sure that they get the product from attested sources. So those that will be inoculated or vaccinated in government drives, I think you can generally count that they'll have proper product. Those that go into healthcare centers privately, probably the same. The ones I worry about are those that go into the back alley, so to speak, places, the unlicensed, unregistered, or morally challenged individuals, even in registered places. I think that's frankly the scary part.
Mm. There's another challenge, and I'll explain a little bit from the side. And we had this on a panel regarding when the vaccines hit the customs, right? Or the plane comes in the airport, and then you have to go through the customs, and sometimes because of this fast approvals, is not even approved in the country. In some of the countries that it reaches, then they need to obviously inspect it. Then they open it up. They take one vial or whatever it is, but then obviously, when you have -70 or -20 degrees, that can temper the whole cold chain requirement for the safe transport. So that's in the airports, right? But obviously, you guys come into play once it passes that. But it's still a big consideration, right? Ensuring that temperature control, ensuring that the temperature stays within the range that it is viable for the product to be then administered. There's a lot of different solutions. We have quite a few questions regarding, I'll pull one regarding IoT, right? So Shiva was asking about IoT. There's a couple of other people that asked about IoT devices and monitoring devices. I guess on this topic of ensuring that temperature is within the range, maybe tell us your thoughts, tell us how DKSH takes steps to make sure that is ensured.
Yeah, so we employ, a number of solutions, technology solutions. We have data loggers in packages. We also have tracking systems. We're looking at, and in some countries we have RFID and barcoding, so we know exactly where the product's going. And certainly very high value, sensitive products like this, I think either the manufacturer will have that technology, and we can then leverage and track very easily where the product is. And very recently, we conducted an experiment with the University of Hong Kong, where we did data tracking and data logging, by small unit, and we looked at their technology that they developed actually in-house, and it was a very interesting technology. And we've employed that in Hong Kong and have used that in trucks to be able to track where the product is. And then we took that logger to the next level and added temperature control to it. So we have this technology. It is available. And the technology was so good, Radu, that essentially the logger gave a signal to the driver if there was an issue. And it also gave a signal to the home control in case something was going on, and they could know. So the driver doesn't have to be contacted by somebody sitting in a head office somewhere and saying, hey, I've got a funny signal. The driver themselves knows that in that box, something was up. So we've experimented with this technology. It works. We have not decided to scale it as yet. It's still a question of affordability, of can we do it? Does it make sense? But I think for high value products such as this, now that we did, and I think we did this 3 years ago, started this project and this test over 3 years ago. And we've seen that it works, and we wanted to do some further testing in a few areas. And we feel pretty confident that we could roll something like that out. And when we looked into, what was available in developing markets, the US, Europe, there was nothing quite like this. So we thought this was a very interesting technology, and that's something we're using. Thank you.
Mm-hmm. No, in many ways, I was sharing with a friend of mine talking about US and Europe. We are obviously biased. Definitely, I am biased. You're biased, I guess, as well. We sit in Asia, but a lot of the things related to e-commerce, last mile distribution, Asia is quite ahead of the curve, and I think a lot of good things are coming in from Asia into other parts of the world as good case studies and examples. I wanted to, shifting a little bit, I wanted to ask you about this a little bit wacky idea, but not necessarily wacky. Maybe wacky is not the right term. I think we need to think a little bit left field in these situations. Rachel White was one of our collaborators, and she was wondering if we're also going to see some creative ideas of clinics, like, you can even take a reefer container, right, and transform it into a clinic. You can plug it into a power source, then you can go inland fairly safely, and basically maintaining that temperature control as well. There's different ways like that. So I guess will we see something like that? Do you see some creative ways of different clinics? I was talking, I know, International SOS, you may know them, they're very, all over the world. They're considering something like that as well in some remote areas. Tell us what you think.
Yeah, thanks for the question. So, Radu, since we're on LinkedIn, and if you look at my LinkedIn profile, you'll see that I worked in Africa for a couple of years, where I was a region head for a large pharmaceutical company. And I remember attending a conference and was blown away by exactly what you described, which was essentially they built prefabricated hospitals. I mean, hospitals. And I was thinking, okay, I've heard of a prefabricated house, but how do you build a prefabricated hospital? And essentially, the idea was exactly what you said, that a lot of the population is less dense, and to keep a hospital in one site may not be economic. You might not get enough catchment area of patients. So having that prefabricated, quickly building it, keeping it there for a while, disassembling it, and then moving it later was very, very possible. And we've seen this used, in many cases. You see this used by emergency management teams when they deal with things like hurricanes, floods, etc., that they know how to purpose and repurpose very simply built construction to meet the purpose. It doesn't have to be elaborate. And let's face it, some of the hospitals that we have around the country are frankly, over-specced. There's too much in them. And when you're talking about a very simple focus of vaccinating patients, you need really then to look very operationally of how do you bring the patients in, how do you register them, where do they have the waiting area, where do they provide the information, where do they take the inoculation, where do they sit for a while to see that they're okay for 5-10 minutes after, and then where do they get the education of what to do next or what, and then they can leave. So essentially, it's like a great operations manufacturing, what do you call that assembly line, moving, and you can build within that prefabricated unit so that assembly line works like a gem. It's so super efficient. So I think there's a lot of opportunities for technology and assets such as that. Particularly here, you're talking about vaccinating the whole population. I mean, typically we talk about vaccinating children. That's already a lot of people. But you don't talk about it as an urgent, you talk about it over time. And here you're talking about vaccinating 70%, 60% of a whole population of a country. Now imagine, the Philippines is 105, 110 million people. 70% of that is 70 plus million people. You replicate that into many other countries, a lot of work. To your second point, very, very quickly, which is on delivery systems, things such as drones. Could you be agile? Could you be left field? Radu, it's a great idea, but I go back to what I always say. We're not in the industry of just building always a better mobile phone. I always use that as the analogy of a mobile phone operator can build it and change it and tweak it very, very easily. In our case, we're a very highly regulated industry. As soon as you change anything, even if you change the operating system in a warehouse from, let's say, SAP to an Oracle or something like that, you have to announce that to the regulatory authorities, conduct tests, show them that the orders will still flow through properly, because here you're talking about patients' lives. So while everybody talks and thinks, well, why don't you use drones? That's a great idea. It's a super way to get things to rural areas. Conceptually, brilliant. At the same time, it needs to be tested. But I think we have an opportunity here to be agile and to have conversations with regulators to say, there's a problem out there we need to solve. We can't wait 6 months or 12 months for the same, regulatory cycle to occur as normally occurs. We need to act fast. How can we do that? So I think that's going to require a proactive conversation, and it has to be then rigorously tested, because in the end of the day, these products are going into our mothers, fathers, husbands, wives, daughters, and there's a sanctity of human life.
And to your point, I want to kind of re-emphasize that indeed, we've all seen that statistic that who accelerated the digital transformation of your organization, right? A, B, C was COVID-19. It has happened. It is happening. It is also happening at a customs, trade, governments level. Definitely, I think things are speeding up. So to that point of regulatory bodies coming together with the business side and coming up with ideas. There's been a couple of very good initiatives at the global level for the air industry. FIATA, Pharma Aero, there's been World Economic Forum that had set up several groups, World Trade Organization. So I think we are on the right direction. But to your point, with a lot of these things, I mean, drones, to be honest, even with other products, we haven't quite mastered the way to do it. So, I mean, I don't think it's a good idea to start with healthcare as a guinea pig. So there's a level of practicality in all of this. I do want to bring into the discussion this point that Jim is making in a way. So I'll use part of his question, because I think you addressed the part with the IoT and the administering at the hospital level. But the point where you do have certain vaccines that require 2 jabs. You have Pfizer, then you have Moderna, then you have J&J and some others that have come up with 1 jab, right? How do you, there's that element, some said it's mix and match, it's okay, some said no, some said, and I'm guessing that, I don't even know personally who is in charge of that. Is the government in charge to say, okay, no, this patient, it's okay to start with Pfizer, then get Moderna because we don't have any more Pfizers, or, you do the J&J. How this whole thing, because it's complicated in my mind at least, right? So how does that work, and what's your role as a distributor in all of this?
Our role is to support governments or to support clients help them get the vaccine out to the patient. So our role isn't to advise them or counsel them or direct them on what type of product should go into which patient for what reason. I think we can all have, intellectual conversations and thoughts, but what I've learned is, and I was talking about this at a party the other day. Party is a hard thing to say. A few people over, which we can do in Thailand at somebody's house. And I was reflecting and reminding that, a lot of people are experts now because they've read X, Y, and Z in Facebook or an article or a WhatsApp, etc., and say, well, this makes sense and this should happen. I think there are a lot of things that potentially could make sense, but I think it's a lot more humble to frankly say, we don't know. We believe, and be very clear and say, here's my assumption, and put that assumption very clearly in the beginning and say, I want to test this hypothesis. But if the hypothesis is based on an assumption that a one-dose vaccine actually works better in a rural area because the risk of them coming back or not coming back is higher, or a vaccine that doesn't require as stringent, low temperature control is better in a rural area than in an urban area. I think conceptually it makes sense. And I think through what we talked about earlier in terms of tracking that data from an epidemiology standpoint, we'll have those answers pretty quickly. And then I think governments who have to make decisions about resource allocation, that's basically what economics is, right? Will then look and say, I get a better bang for my buck. And the bang is also the protection of people and their society, not just the buck, but they have to look at both the bang and the buck by deploying this vaccine in this way, this vaccine in that way. But I think, again, it starts with a humility of saying, I believe, here's my hypothesis, here's my assumption, let's keep testing it. I think the sad one is when people speak so forcefully and so, like some of these analysts on CNBC or whatever, and they come out and they go, I know. We don't know. We didn't know a year ago. We didn't know 6 months ago. How many people really, really thought that we'd have vaccines in our hands in December? I've got to say, back then, I was one that used to WhatsApp my friends and say, the fastest vaccine that was developed was 3 years. To think that you're going to have a vaccine within a year, you're smoking something. And I was humbled. So it made me realize, hey, there's a lot that can happen when people work together, when there's a singular focus, when frankly there's a lot of money and there's a big problem. So I think our ability to solve problems as human beings is infinite. But I think if we start with that adage of Steve Jobs of stay foolish, that'll be a good one.
Yeah, we definitely need more of that. And we need more people not to believe the first thing that they see on Facebook and try to educate ourselves with different sources of truth, whatever that truth is, because ultimately, I don't know if there's one source of truth, but, at least have that openness and humbleness to learn from different sources. On that note, I want to end on this big question. Maybe the most important question. I'll pull it up here it came from Shan Chu. I guess it's vaccination rates in Asia, APEC versus UK, Israel. I guess the question behind the question is, when do you think it's gonna, my question at least, I'm reading it from Sean, but my question, when do you think we're gonna see Asia at large, right, out of this and vaccinated at the level where we have that herd immunity?
As they say in French, je ne sais pas. I have a hypothesis, and my hypothesis is that smaller, richer countries, Singapore, Taiwan, Macau, Hong Kong will be able to do it faster. They have the resources, they have the infrastructure, their populations are smaller, they're more densely located in a smaller area. Makes sense. Other countries that are more the opposite of all the things that I've just said, high populations, geographically dispersed, economically challenged, lack good information systems, lack infrastructure, and in some cases, aren't yet fully properly organized. Frankly, those will take longer, right? Now, there was an EIU report that just came out. I think there was another one that I saw on LinkedIn just today that talk about some of these countries, from the first group, perhaps getting 70% vaccinated by the end of this year, maybe even early next year, but by the end of this year. That's probably feasible. If you're talking about a country like Singapore, it's not easy, but it's probably feasible. When you're talking about some of the, what I call frontier markets, the newly emerging developing countries in Indochina, and some of the countries which are very, very, very large populations in thousands of islands, I think we can all predict that it's not going to be that quick. And whether it's going to be 2023, 2024, 2025, or ever, I don't know. And then, frankly, I'm sorry to say, it could very well be that in some of these countries, you will never get to 70%. Just because many of the people are just not easily accessible. I hope that's not the case. Maybe this will be a platform by which we can create much better access in healthcare for populations that are challenged, that are, affected by war, people who we don't know their identities, they haven't ever registered. There are many people like that in this part of the world in some of these countries. So maybe this will be a platform, a mechanism by which we can bring some of these people into the system, so to speak, and give them the same benefits, the same access that many of us have.
Hope so too. Fingers crossed for that, Bijay. And okay, we had some more questions, but what I will do is we have a couple more questions. I'll take you offline, and then maybe you can answer in writing to some of them. Many thanks for your time, for the reality check, for the practical, pragmatic, and real sharing. Do encourage all of our listeners and all who see this or who will see this, because it stays on LinkedIn, so you can watch it later on. Do contact Bijay or the DKSH team if you think it is helpful, or if there's some potential partnerships, collaboration going on. Good luck in the humongous task ahead, Bijay, and stay healthy to help in the vaccination process.
Yeah, Radu, thanks a lot for the opportunity. Thanks to everybody who sent in the questions. We're going to have to work as a big community here. This is really an ecosystem effort, and we thank you for your efforts in getting more education, more awareness, and supporting the discussion. Thank you, Radu, and thank you, everyone.